Bumps on lips 2 weeks after filler. My injector says to massage them with firm pressure. Will this make them go away? I have bumps on the top lip when I smile, and it's making me self-conscious. It's been 2 weeks since my lips were done. I don't really want to get injected with dissolver, because it takes me a while to heal from injections, and I bruise easily. I've got to go to work and serve people all day, and I usually take time off for fillers.
Thank you for your question. You submitted your question with a single photo, and you're describing in the details of your question that it's been 2 weeks since you underwent lip filler, and that you have several bumps in your upper lip, especially when you smile. And the injector advised you to massage this area. You are aware of potentially having this material dissolved, but you are hesitant to go that way because it takes a while for you to recover from bruising and swelling, and that you take time off when you have lip filler, and so you work in a job where you serve people. So you are, of course, caught in a situation which is a bit challenging, where you're concerned about an appearance, and you are, of course, concerned about any downtime related to any corrective action. Well, I can certainly share with you my thoughts on this situation based on the limitations of your history and the photos in the absence of a physical examination. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with their lips aesthetics is something we do in our practice every day. And I can certainly share with you that I have evolved in my approach to help my patients with lip enhancement, since there is often been that particular challenge of the desire to have an improvement, but at the same time have a minimal amount of swelling and downtime, and do something in a way that can be consistent. And so I'll discuss my approach in a moment. To begin with, the perception I have from looking at the multiple, what appears to be islands of filler that are relatively superficially placed, that it would be my conclusion that the injectable filler, most likely a hyaluronic acid filler, was placed by doing multiple injections into the lip, and that some of that material was released relatively superficially, hence the causes of the bumps. With lip anatomy, generally speaking, enhancement of the volume of the lip, in my experience and my approach in doing this type of work, is to place the volume mostly deep, and anything that's superficial is limited to areas that are not in that pink area and more along the lip border, okay, also known as the vermilion border. Now, that being said, you're in a situation where the strategy and the approach probably induced a certain amount of significant swelling, which is why, of course, you need to take some time off. I think that from that perspective, that these bumps are probably going to get somewhat better from just the massage, as your injector recommended, but hyaluronic acid fillers, at a certain point, will actually reach a certain equilibrium or balance, and it might persist until the body breaks it down. And so you have to decide whether or not you're comfortable with allowing that certain amount to be present. Generally speaking, when we do injectable fillers in our patients, whether it's for lips or anywhere else, we see patients after 2 weeks, and I can generally predict that whatever I see at 2 weeks is basically going to be stable for a while, and that the initial first week or so there's a certain degree of swelling that can affect the picture. When I do volume enhancement for lips, I generally use a technique using blunt cannulas. And I have found that I have been able to significantly improve my outcomes using this approach. Essentially, I strategically place entry points, and then I place the filler in a way that minimizes the trauma and bruising and swelling. Further, I find that I can have a lot more control in getting the level of the lip that I want enhanced and avoid some of these more superficial placements. It's not like it's impossible, and certainly can happen, but I would say that in my experience that this technique has been very consistent. You know, when I read something like in your situation where you often have to take time off to allow for swelling and other things to resolve, well, that's, I think, one of the reasons why what motivated me to help my patients through evolving the technique. Because once someone gets a nice result that they like, well, eventually the filler goes away, and they want to naturally do it again. But if they have had a not so great experience, they may be hesitant to do that. So it's important with any aesthetic procedure that requires maintenance that you do everything you can to minimize swelling, bruising, and maximize predictability. Doesn't mean that at the 2-week visit, sometimes patients want more volume, and they may ask for more volume, and of course that's fine, or little enhancements, which is also fine. But I think that this is a situation where the material is kind of focused in different little tiny islands. Now, like I said, it is possible that with a little bit of massage and just natural movement from smiling, talking, moving, you will be able to get resolution. I would say, to address the question about the hyaluronidase and the use of an enzyme, yes, you can maybe get a little bit of some swelling, but I would say that since the areas are relatively small, a small amount of enzyme may go a long way. So it might be a decision you choose to do maybe in a couple of weeks after it has settled out. And if you're still bothered by the appearance, then you can address it with the enzyme and maybe allow for a day or so of swelling that may be related to just the procedure. Again, there's a lot of nuance in the approach, the style, the touch, and of course the fact that lips are sensitive and can swell. So it's, even in the best hands and even in the most delicate approach and the most experienced hands, a little bit of swelling is still going to be a normal part of the process. So talk to your injector about this, maintain your dialogue, and of course document I think it's a good idea to kind of just document for yourself, like the photo you took, and see if a week later it looks pretty much the same, or 2 weeks later it looks the same. At that point, it might be the most practical thing is to dissolve some of this filler and just let things not look as irregular. It's difficult to appreciate the three-dimensional aspect of your appearance with a two-dimensional photo, and that's where a physical exam is obviously superior to just the photo. So I hope that was helpful. I wish you the best of luck. Thank you for your question.